Okay, right. So today we want to talk about how can we monitor and maintain good cardiac health. Right. So please refer to page number 10 of your notes. Right. So these are the objectives. I will not be reading through them. You can just pause this video and take a look at them if you are keen to know more. Alright, so basically what is cardiac health? So the state of health of our heart and blood vessels is known as cardiac health. So basically how healthy your heart is and how healthy your blood vessels is, this is known as your cardiac health. So a person with good cardiac health means he has very good blood circulation. The blood is able to flow smoothly and continuously around the body. Now the issue is if blood flow is slowed down or even stopped, the body cells, okay, so mean the other parts of your body like your brain, like your heart, like your skin, right? The body cells will not get enough oxygen and food. In severe cases, some of these cells may even die. So blood flow can be slowed down or stopped when there is a blockage in the blood vessel. So this occurs, actually it occurs in many different situations, okay, but one of the ways that it occurs is when fat, cholesterol and other substances build up in the walls of arteries, forming structures called plaque. Okay, so how does plaque look like? Plaque looks something like this, right? So this is how plaque looks like, right? So in a normal healthy person, this is how the blood flow will be like, right? So you will have uninterrupted blood flow. Okay, so the blood flow will flow uninterrupted. But when there is a build-up of plaque, right? So plaque build-up is due to a lot of factors. Some of the factors is due to the presence of excess cholesterol, is due to the presence of excess fat, is due to the presence of excess salt. Okay, actually smoking, okay, can also result in plaque to build up. So when plaque build up, you can see that your blood vessels gets narrower like that. All right. So if plaque is found in an artery that supplies oxygen to the heart muscle, blood supply to the heart muscle will be cut off. So the heart muscles may not receive enough oxygen and may even stop pumping. So when this happens, this results in a heart attack. So you see, it's actually very interesting. Okay, your heart is actually responsible for pumping blood around the whole body. But the heart itself also requires oxygen. The heart itself also requires digested food for it to continue to work. So if let's say, for example, the blood vessels are blocked and then the blood cannot reach the heart, right? And then the heart itself is not able to get digested food, not able to get oxygen. And then what will happen is that the heart muscles may not receive enough of this and it may stop working. And when that happens, this results in a heart attack. Alright, so now let's take a look at a video, alright, a YouTube video on a heart attack. Right, so let's take a look at this.
If you have acute coronary syndrome, you have one or more conditions caused by a blockage of blood flow to your heart muscle. This is a medical emergency because you may be having a heart attack, a condition in which your heart muscle begins to die. Your heart is a muscular organ that pumps blood containing the oxygen and nutrients your body needs. The main pumping chamber of your heart is the left ventricle. When your left ventricle contracts, it sends oxygen-rich blood to your body through a large artery called the aorta. Connected to your aorta are small arteries called coronary arteries. Blood flows from your aorta through the coronary arteries to supply your heart muscle with oxygen and nutrients. If you have acute coronary syndrome, blood flow through your coronary arteries is severely reduced or completely blocked. One possible cause of reduced blood flow is atherosclerosis. In this condition, a buildup of a fatty substance called plaque can narrow your coronary arteries. If this plaque ruptures, a blood clot can form and block the artery. A blood clot is the most common cause of coronary artery blockage. Other less common causes of reduced blood flow include coronary artery spasm or dissection. In a coronary artery spasm, triggers such as drugs, smoking, cold weather, and extreme stress or emotions can cause a temporary and sudden tightening of a coronary artery. During a coronary artery dissection, the inside wall of one of your coronary arteries separates, which can block blood flow. Regardless of the cause, a blockage in either coronary artery prevents the oxygen and nutrients in your blood from reaching the part of your heart supplied by the artery. As a result, heart muscle in that area starts to die. Death of part of your heart muscle is called a heart attack. It's also known as a...
Okay, so that is what causes a heart attack, right? So in a normal heart, right? Okay, so this one is a normal heart, okay, with normal blood vessels. Okay, so the artery that supplies the blood vessels is healthy, the blood can flow smoothly, right? So in this scenario, right, when you have blocked arteries, right, when your arteries are actually blocked, then what will happen is that your blood, which is supposed to flow smoothly, now get stuck or get blocked. Right, and when that happens, the blood is not able to reach the heart. So if the blockage is in an artery that supplies blood to the brain, blood supply to the brain is cut off instead. Right? Okay, so this is page 11, okay, of your note. Okay, so the blood supply to the brain is cut off instead. Alright, so if let's say the blood is supposed to go to the heart, but the artery that goes to the heart blocks the blood, then there will be a heart attack. But if let's say the artery that is supposed to supply the blood is supposed to go to the brain, then when the blood supply is cut off, this will result in a stroke. Okay, so a person who is suffering from stroke may experience numbness, paralysis, loss of hearing, and eyesight. Okay, in severe cases, death can also happen. Alright, so this is a diagram to show you the difference, right? Okay, so let's say for example the blood over here, right, supposed to go to the heart, okay, but then cannot go into the heart, okay, it gets blocked, right? So when it gets blocked, the heart cannot work properly, the person will get a heart attack. Okay, this one over here, okay, if let's say for example the blood vessel, okay, the blood vessels is supposed to go to the brain, the blood is supposed to travel to the brain, but if let's say for example, okay, the blood vessel for some reason is blocked, then what will happen is the person will get a stroke. Alright, so we mentioned stroke, right? Okay, so let's take a video, or let's take a look at a video of how we can actually identify stroke and what stroke is all about. Alright?
Oh, thank you. What's wrong with his face? It's probably nothing.
He's having a stroke. I'm calling 995.
You can spot a stroke. F. Face drooping on one side. A. Arm weakness. S. Speech difficulty. T. Time to call 995 for an ambulance immediately. If you spot any of these signs, stroke is an emergency. You can spot a stroke. Remember, FAST. Visit Healthy.
Okay, so now going back to how we can monitor our cardiac health, right? So we can feel and observe our blood flow in the following ways. Okay, we can either feel the pulse, we can listen to our heartbeat using a stethoscope, or we can actually measure our blood pressure using a blood pressure monitor. So we can monitor our cardiac health by measuring our pulse rate or heart rate, okay, or by measuring our blood pressure. Okay, so heart rate, what is it? It refers to the number of times the heart beat in 1 minute. So when we listen to our heartbeat, there are two sounds that we can be heard. Alright, so there will be a lup dup, lup dup, lup dup. So each lup dup is considered as one heartbeat, right? So you can actually measure your heart rate by actually placing your hand against your chest actually. Okay, when our heart beats, it pushes blood out into the arteries. The contraction of the muscles on the artery wall creates a pulse in the artery. So we can feel this pulse as a thumb on our wrist or on the side of our neck, right? So you can actually put it against the side of your neck like that. Okay, you can put it against the side of your neck like that, or you can put it against your wrist, and you should be able to feel your pulse. Okay, so we can measure our pulse rate by counting the number of pulse we feel in 1 minute. So the pulse rate for normal adults at rest, okay, okay, can range from 60 to 100 beats per minute. Okay, our pulse rate will increase when we exercise. Okay, I'm sure you know this, right? So when you run or when you exercise, you will feel that your heart will beat faster, and therefore because the heart beats faster, the blood will actually push against your muscles faster, and therefore you can actually feel your pulse. Alright, okay, so for very healthy athletes, right, so we've seen this photo before. Okay, for example, the famous boxer Muhammad Ali, right, the heart rate is about 46. Okay, Mr. Ali, not Muhammad Ali, yeah, Mr. Ali, pulse rate is about 70. Okay, so definitely not as fit as Muhammad Ali. Alright. Okay, so during exercise, our pulse rate increases. We also breathe faster and more deeply. When we exercise, our muscles need more energy to do work. In order for our muscles to release energy, we need to supply our muscle cells with more oxygen, right? So that's why when we exercise, our body needs more oxygen, our muscles need more oxygen, our cells need more oxygen, right? So the body responds by breathing faster and more deeply, right? So you'll be like, like that lah, right? Okay. Okay, our pulse rate increases as our heart beats faster. To carry more oxygen to the muscles, our breathing rate also increases because we need to breathe faster to take in more oxygen. Okay, so generally for a fit person, okay, it will look something like that. Okay, before exercising, okay, when the person is at rest, right, the pulse rate will be something like this, okay, slightly below 60, right? This is for a very fit person. Okay, for an unfit person, okay, will be something like that, close to 80, right? Okay, and then when you exercise, both the fit and unfit person, the pulse rate will go up, okay, but the unfit person will go up more, right? And then after the exercise, the fit person, okay, the pulse rate will drop back quickly, okay, and then it will stabilize back. For the unfit person, the recovery time will be longer before he or she eventually reach the heartbeat when he or she is at rest. Okay, then next, what is blood pressure? Okay, so when blood moves through the arteries, it pushes against the side or the walls of the artery. So when the blood is moving through your blood vessels or through the artery, what happens is that there will be force acting on the walls of the blood vessels, right? So the blood will push against the blood vessel. So when it push against the blood vessels, there will be a force, right? So the amount of force acting, okay, will be your blood pressure. Okay, if your blood pressure is too high, it will put extra strain on the arteries, right? It also increases the risk of getting serious illness like heart disease and stroke. Okay, so what it means is if your blood pressure is high, the blood is pushing against your arteries at a very high force. So this is not very healthy. Okay, not healthy for your blood vessels, not healthy for your organs. Okay, so high blood pressure can be caused by a diet in saturated fat, cholesterol, and salt. Okay, of course, a little bit of this is okay, right? But what we don't want is we don't want to have a diet which is high in all these. Okay, so please include this as well. High in saturated fat, cholesterol, and salt, and a lack of regular exercise. Okay, so let's take a look. Okay, on the left is a healthy person. Okay, so this is normal artery. Okay, this is healthy blood vessel, right? So this is a healthy blood vessel. Okay, what you will notice is the blood vessels over here, this one over here will be unblocked. Okay, so it will be unblocked. So what happens is that the blood can flow very smoothly, all right, in your blood vessel. Okay, what happens when you have all these fatty deposits? Okay, fatty deposits is also known as your plaque, right? Okay, it's also known as your plaque. So when all these fatty deposits actually build up, okay, because of your poor diet, lack of exercise, then what happens is that it causes a very narrow amount of space for your blood to flow like that. Okay, so you have a very narrow amount of space for the blood to flow. Okay, so excess fats and cholesterol, like what I say, form our diet, settles on the inner wall and forms plaque. Okay, causes the blood vessels to narrow and blood flow to be restricted. Okay, so when there is very small space for the blood to flow, the blood will push forward more forcefully through the narrowed blood vessel, and this causes the blood pressure to increase. It's just the same like, for example, when you use a spray, right, and then you actually reduce or you squeeze the tip of the tube, alright, and then you find that the water will push forward with a larger force, right? So this is dangerous. Why? Because over time it may damage the artery wall or even cause it to burst. Right, okay, so for example, this is how it looks like, right? Okay, this is how your blood is actually flowing through your arteries, right? So it's flowing like that, right? Flowing out like that. Okay, so if it's blocked, okay, let's say for example it's blocked like that. Okay, let's say for example the blood vessels are blocked like that. Okay, with this available amount of space, the blood will have to push forward more forcefully, and that's how you get high blood pressure. So when the pressure is high, it may actually cause the blood vessels over here, okay, to get damaged. Okay, because the force of the blood acting on the blood vessels is very, very high. Okay, and it may even result in damaged organs. Okay, so what causes high blood pressure? A lack of exercise, okay, high intake of salt, okay, high intake in cholesterol, high intake in fats. Okay, so all these can result in high blood pressure. Lack of regular exercise means that the heart is not trained to beat efficiently. Okay, over time it may become weak and the body cells cannot receive oxygen. Okay, high salt intake is also known to increase blood pressure. This may cause heart problems like heart attack and stroke. Right? Okay, so